Hello and welcome to the Maiden episode of The Last Mile with Naca, a public enlightenment and sensitization series by the National Agency for the Control of AIDS, Naca. I'm Adesuwa Osui. Why and when was Naca created? What is its mandate? What are the strategies deployed in the push for the last mile in ending HIV deaths and new transmissions by the year 2030? The answers to these questions and more in just a moment. Don't go away.
The human immunodeficiency virus and acquired immunodeficiency syndrome, HIV and AIDS, has existed in Nigeria for over 30 years. The two index cases were discovered in 1985. In response to the devastating effect on both Nigeria's health and socio-economic status, the federal government set up the National Action Committee on AIDS in the year 2000. The National Agency for the Control of AIDS, Naca, was later established under an Act of Parliament on February 22, 2007 to coordinate the various HIV and AIDS interventions in the country. With the leadership of exceptional personalities with impeccable track records as its Directors General, the agency has ensured that the national HIV response has approached its last mile. Currently at the helm of affairs is Dr. Gambo Gumel Aliyu, a world-class epidemiologist and a public health specialist. Before his appointment to head Naca, Dr. Aliyu served as country director for the University of Maryland programs in Nigeria and assistant professor in epidemiology and public health at the University of Maryland School of Medicine. He was among the first Nigerians to receive in-depth trainings on establishing antiretroviral and the prevention of mother-to-child transmission centers of excellence. Over the last 15 years, he was vastly involved in HIV research and program evaluations to support decision-making. In 2005, he co-pioneered mobile HIV testing service delivery to key affected populations in the process of implementing an HIV seroconversion study in Nigeria. In 2017, he evaluated two national HIV treatment program strategies, Test and Start and Community Antiretroviral Therapy, critical to scale up of antiretroviral treatment for achievement of sustainable HIV epidemic control. He spearheaded the world's largest HIV population-based survey, Nigeria HIV and AIDS Indicator and Impact Survey, NAIS, which helped Nigeria to know the true status of the epidemic and impact of HIV services delivered in the last 15 years. Among other purposes, Naca's mandates are to coordinate and facilitate the mobilization of resources by all sectors and at all levels for an effective and sustainable response to HIV and AIDS in Nigeria.
Naca was established in 2007 solely to coordinate the national response for the control of HIV/AIDS. And this national response is a multi-sectoral in nature. What do I mean? This response involves different ministries. It involves Ministry of Health that focus on treatment. It involves, let's say, Ministry of Defense that has an entire program, that is a replica to what we have in the general public. It involves Ministry of Education that has this body mass of students all over the country. It has Ministry of Youth and Sport in it. It has Ministry of Women Affairs. It has all other agencies that have individuals or communities or population groups that are at risk. And when you take of youth and sport, they are a very integral part of HIV prevention and control. So what Naca does is Naca coordinates all activities that are taking place in this and accounts for virtually everything that is happening in terms of prevention and treatment that is needed to control HIV in the country.
Dr. Gambo Aliyu's leadership style has greatly impacted Naca's culture, structure, and strategy in just a short time in office.
When I came, I made it clear that I have two goals. One is to control the epidemic, and two is to provide infrastructure for sustainability. I'm happy to say on the side of the control, we have recorded tremendous success. And we are looking at a year from now, or a maximum 18 months, to reach that bridge, to say that HIV transmission is controlled in Nigeria. On the second part, providing infrastructure, when I came up, I had one office that we have here in Abuja. But now we have 7 offices all over the country. We have an office in each of the 6 geopolitical zones. That helps us to come closer to the community. That helps us to go closer to the grassroots, to see what the development partners are doing in terms of helping us to control the epidemic, to see what other stakeholders in this multi-sectoral response are doing, to monitor and evaluate activities that are taking place by implementing partners at the grassroots, and to make sure our programs are adding and in terms of strength, are given us strength, not duplicating each other, in terms of our implementation.
With his epidemiology background and a passion for data-driven implementation of the national response, Dr. Aliyu facilitated the creation of a central data repository for all HIV management in the country.
The importance of the repository is to help us monitor and evaluate. Before, we don't have means to monitor and evaluate. If I sit down here, I don't know what is happening in Taraba. I may not know what is happening in Abia. I may not know what is happening in Kano and other places in terms of how many people are taking treatment in what facilities and how these people are doing. But as I sit today, I can look into a system to know how many treatment facilities do we have, for instance, in Kano, and how many people do they have on treatment, whether these people are still on treatment or have dropped out of treatment. If they are still on treatment, how well are they doing in terms of making sure that this virus is controlled within them? Another thing we have done is that we've changed the way we do business here. We're now getting drugs at rates that are way cheaper than we have them before. When I came on board, we were buying drugs at a rate of $13 per patient per month. Now we are buying at a rate of $7 per patient per month. And we were buying test kits at the rate of almost $3 per test. Now we are buying test kits at a rate of less than $1.85. So we have done so well, in making good use of the little resources we have, and we have done so well in working with our development partners to make sure we are all out everywhere, and we focus our attention where we think HIV is spreading fast and HIV is identified more, to make sure we get people that have the disease, place them on treatment.
Currently, statistics show that Naca has done exceedingly well for the last mile push.
The last mile is saying that we are in the last lap of the race to control HIV and to make sure we move at the same pace or at the faster pace with the global community. When this marching order was given by the president for Naca to push for the last mile, we have done a tremendous job. When this marching order was given, I think we have about 800,000 people on treatment. Today, less than 3 years from that marching order, we have doubled the number. We have about 1.6 million people on treatment, and we are counting. And that has been a phenomenal job because we've done something that no other country in that respect has done in the world, identifying almost 350,000 people within a span of a year and a half or less and placing them on treatment. No country has ever done that, and we did that despite COVID-19.
Despite successes recorded, a lot more needs to be done by way of shared responsibility and accountability, responsible implementation, and stronger partnerships. But the National Agency for the Control of AIDS is not sitting on its oars, with an even stronger resolve as it pushes for the last mile.
What we want people to know is that there is an act against HIV, stigma, and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
The Update segment brings you the activities of the agency across the country and the globe. Keep watching.
The Namibian High Commissioner to Nigeria, Humphrey Gaisab, was recently at the Naca headquarters in Abuja on a courtesy visit. Speaking on the purpose for the visit, Humphrey Gaisab commended Nigeria's excellent response to HIV, which he described as one of the best in the world, and that his country is willing to learn the Nigerian HIV and AIDS elimination example.
We in Namibia are encouraged by your achievements, and definitely many Africans in this great continent look at Nigeria as the window of Africa to the world. What happens in Nigeria matters to the continent. What achievements Nigeria is registering in the area of HIV/AIDS will be an encouragement to the rest of the men and women in this continent who are working on eradicating HIV/AIDS. So continue the good work and tell the story of what you are doing. We Africans are not good at storytelling. We are good in the village when we sit around the fire. But to tell the good stories of our agencies, we are sometimes not excelling.
Welcoming the Namibian High Commissioner, the Director General, Naca, Dr. Gambo Aliu, opined that the building block to ending AIDS is in the prevention of mother-to-child transmission of HIV. The Director General also expressed Nigeria's readiness to collaborate with Namibia. HIV and AIDS is still a major problem that the world is facing. However, effective HIV prevention interventions have proven to reduce transmission. The National Agency for the Control of AIDS, Naca, recently celebrated 14 years as an agency. The occasion, dubbed the National Response Stewardship Day, provides a platform for reflection and future projection for ending HIV and AIDS as a public health emergency in Nigeria by 2030. In attendance were many dignitaries, including the Secretary to the Government of the Federation, Country Director, UNAIDS, representatives of implementing partners and civil society organizations and other relevant stakeholders.
I just rushed out of a meeting with my colleagues and I asked all of them, please tell me what is the most important thing that comes to mind when you think of Naca at 14 years of age. Dr. Gambo, they say that Naca represents the face of the response for HIV in Nigeria. It's undisputed. The face of the response of HIV in Nigeria is what Naca represents. They say to me that Naca provides very clear national leadership on strategic issues concerning HIV. And they say to me that Naca has been effective in the decentralization and ownership of the response at the state level.
Thank you. If not for the policy, National HIV/AIDS policy, National HIV/AIDS strategic framework first, and then the plan, people will probably be drawing money from different sources all over the world, doing whatever they like in the corner of their rooms. But with that vision, from Naca leadership, it set the tone for what should be done, how it should be done, by who, at what level, and what result, more importantly, what result do we expect to see. So I think we need to applaud Naca for that. And also, very importantly, you can't do anything without capacity. I think one of the key benefits we've gained from Naca as a country with regards to response, even beyond HIV response, health system strengthening, is capacity that Naca has institutionalized all over the country. So on that note, I want to appreciate Naca once again and commit that from CCM perspective, we will constantly and regularly partner with Naca beyond what we are doing at the moment to also include other areas that will come up, as we move forward.
Today, HIV is like any other chronic disease. And all of this is due to the collective efforts of Naca, the leadership of Naca, providing leadership in policy direction, capacity building, and also strategically positioning different dramatics personnel to ensure not only prevention programs, but also treatment programs. Congratulations.
As an implementing partner, we've truly enjoyed the leadership, the policy direction that Naca had provided over the years, particularly the ability to keep scaling so that even at the different stage of the epidemic, we have a body that has truly responded to the peculiar needs of civil society and implementing partners. So for this, I congratulate you. I think just to say, we are truly excited. This is just 14 years, and we look forward to the years ahead, even as we continue to count on the very strong leadership of Naca to frame the policy direction that will finally take us to end this epidemic. But more importantly, to sustain the gains we've made. And I can see some really exciting discussions already in place. So congratulations for the journey so far, for the great success recorded, and to say we are truly proud to be associated with Naca.
In 2007, we started with a prevalence of about 4.6%, estimated people living with HIV/AIDS of about 3 million, and then we had only 200,000 on treatment. We had only 251 treatment sites, and our prevention curricula and mechanism, was not really fully developed. If you look here carefully, you will see between 2007 and 2017, we have added net on treatment about 625,000 people. But if you look at what was added in the last 4 years in this administration, between 2017 to 2020, we have added almost the same number we have added 10 years before that time. So this is the game change. And this is what the energy the NICE brought about. This is what the energy, the political commitment, and the leadership we have had in this administration has brought to bear, on HIV. This slide didn't come from me. I didn't make this slide. This slide is from United States government. What this slide says is that among all PEPFAR-supported countries in the world, Nigeria has the greatest yield in the last fiscal year, between September 2019 to October 2020. And this makes Nigeria the highest country with highest net new in PEPFAR history. And this is what is capturing the attention of the world. Despite COVID, despite the upset we have from COVID, Nigeria has rebounded, and Nigeria has rebounded strong, and Nigerian HIV is now leading the world.
Thank you.
In the last 14 years, I make bold to say that this agency has achieved so much in its mission to the admiration of government and partners. With the onset of COVID-19, the Naca model has worked well in demonstrating resilience and mitigating its impact on the country. Through very strategic and favorable policies of government, millions of people now have access to ARVs, and global targets for prevention, testing, and treatment are being met. The present government of President Muhammadu Buhari has continued to make resources available through Naca to sustain this momentum. This includes the commitment to have additional 50,000 Nigerians placed on treatment each year, feat no past government in this country has achieved. Be assured the government will continue to do more, as it has faith in the diligent commitment, accountability, and transparency of the management in the agency. The Director General and other management staff, I look forward to your continued leadership as you guide Naca to the next phase of history.
The National Response Stewardship Day was highly successful.
A major challenge facing HIV control in Nigeria is the growing number of people living with the virus but are yet to learn about their HIV status due to fear of stigma and discrimination. HIV SelfTasked is a simple, effective, and quicker way of learning about your HIV status in the privacy of your home. The test can be performed using saliva by rubbing the outer part of your upper gum, followed by the outer part of your lower gum with a flat pad, and then dipping the flat pad into a buffer tube to wait for 20 minutes for the result to read. For more information, contact our call center at 6222 or Naca's website. Our services are available to you Monday to Friday every week.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. As you must have learned, Nigeria has done tremendously well in the fight against HIV through the efforts of Naca. Support the HIV response, avoid indiscriminate sex, do not stigmatize or discriminate people living with the virus, and lastly, know your status and take action. Till next week on The Last Mile with Naca, I am Adesiwa Osui. Goodbye.